So there is a number of germline predisposition syndromes in MDS that predispose to the development of MDS or AML across different age groups. So for example, in adults, the most common germline predisposition syndrome would be the DDX41 germline syndrome disorder, and that predisposes to MDS in adults. Whereas in children, we see more diseases that are called, for example, GATA2 deficiency and SAMD9 disorders. And this is the focus of my research actually, is the pediatric MDS and the predisposition syndromes that are found in this pediatric population. And we know that GATA2 deficiency, for example, can develop during childhood. The patients can develop MDS or AML during childhood, but they can also progress slowly over decades and develop MDS, AML, or other myeloid malignancies in the adulthood. And we know once the process kind of starts, when patients develop cytopenias, they develop clonal aberrations, we know this is a process that doesn't improve spontaneously, so these patients need to be transplanted. So that's what we know about GATA2 deficiency. Once you develop symptoms, the only cure for the patient will be a bone marrow transplantation. Now, a different disease that kind of phenotypically can manifest in a similar way is SAMD9 and SAMD9L syndromes. This is a fairly new disease. It has been initially identified about 5 years ago in cohorts of patients with different phenotypes. For example, patients with cytopenia and ataxia, neurological symptoms, or patients with cytopenia and endocrine diseases or gastrointestinal issues, and those were mostly small, very sick children. Now we have identified so far over 250 patients with SAMD9 and SAMD9L mutations. And the unique aspect of SAMD9 and SAMD9L is that they can actually, some of these patients can spontaneously improve over time, because what happens is in the bone marrow there might be stem cells that repair themselves through a process of genetic recombination. For example, loss of the chromosome with the mutant SAMD9 allele or SAMD9L allele, or replacement of the mutated copy of the SAMD9L. So for such patients, there is a hope that they can actually spontaneously improve, and a bone marrow transplant might not be needed, even though they were diagnosed with MDS and monosomy 7 as young children.